Hi, I'm Jade and I'm the owner of Birthable and I'm also a practicing midwife. So today we're just going to talk about what happens when you are pregnant. So firstly, congratulations, you are now pregnant and I'm sure it's a special and lovely occasion. For some of you, you might be a bit overwhelmed with it if it came as a surprise. However, what I'm going to talk through now is what you should do next. Okay, so once you find out you're pregnant, I would assume that you've done a pregnancy test. Some of you may want to do a second one, and that's absolutely fine. For others who like to have that ensure control element, you can go to your GP and ask for a blood test or ask a midwife for a blood test, and we can confirm your HCG levels of pregnancy through that test. But for the most of it, generally midwives, we don't ask you to do another pregnancy test for your first appointment. We just assume that you've done that at home. Okay, so once you've definitely confirmed that you're pregnant through your pregnancy test, what you need to do, figure out what location you're in and decide whether you want to go straight to a midwifery team, which you can apply to, or you can go via your GP. So in Jersey, Channel Islands, we still go through the GP system, where in the UK, you can choose to go straight to the midwifery community team. All you need to do is phone your GP or the midwifery team and just let them know that you're pregnant. How do I follow that process? Generally, we will give you a form to fill out and give you an appointment date for your first appointment with your midwife, which is what we call a booking appointment. On your first booking appointment, what we will do, we'll give you a urine sample pot. We ask you to do this every single time before your appointment. Yeah, we do expect you to sit in the reception area with that pot. You're welcome to cover up with tissue if you need to, but before every midwifery appointment, we will ask you to do that, and that includes your GP appointments. Then you will go in and meet your midwife. Okay, so everywhere in the UK and Channel Islands, we do it very differently. Sometimes we like to have the same midwife throughout your process, where others, sometimes the midwife works within a team. However, the way the UK is currently going, we try to minimise the amount of midwives you see in your antenatal care package. During the booking appointment, it is an hour long generally, and we do ask a variety of questions. Some are really weird, some are really straightforward. However, I do promise we ask every woman the same questions. During the booking appointment, we will go through your partner's history, medical, family-wise, your history, medical and family-wise, any pregnancies you've had in the past, and what happened with them, any terminations, abortions, and how everything is at home. Generally, there's lots of nuts and crannies we can go down, but generally this is the topic. The reasons we ask these questions is because we're trying to think, okay, what are your risk factors for yourself? Do we need to add anything to your care package? And is there any risk for your little one? And also, do we need to add any tests for your little one in the first 6 weeks after you've had the baby, or anything we should be really conscious of at the time of birth? During this booking, we're also assessing, would you be midwifery-led only, or would you need some input from our doctors? Yeah, we're different to the doctors. So we're midwives, we tend to stay within our low risk. We look after you and your pregnancy and make sure if there's anything changed, we get the doctors involved. The doctors we call in are called obstetricians, okay? They're not the enemy, they're actually on our team too, and we work very, very closely with them. So the obstetricians are the ones that can assess what has happened in your scan and analyze the outcome of what the results are in those scans, assess what other blood tests that you need, and they can have conversations with you whether you're an elective C-section, inductions, and the range that keeps on going. The midwives, we work very closely with the doctors, and generally we come up with a care plan that not only suits both of our angles, but yours too. Hopefully that helps. Okay, so you've done your booking appointment. What generally happens now, that booking appointment is normally between 8 and 10 weeks. We have to get that booking appointment done by 12 weeks. However, if you found out you were pregnant quite late and that booking appointment's after that, do not panic. We will get everything back into place. Once you've had your booking appointment, we will send you to our scanning department, okay? Most women will call this as your dating scan. Yes, I know, you probably knew when your last period was, however, we don't go by that for your due date, we go by our scan. So in this dating scan, we ask you to have a full bladder, and this will help the scanning team to be able to assess that baby better on that day. Sometimes it takes 10 minutes, sometimes it takes an hour, sometimes you're asked to walk away and come back, and that's just to get the baby in the right position so they can scan. In this scan, what they will do, they will assess the height of the baby and then correlate this to how old we think that baby is to give us a guesstimate when that baby's due. A lot of women wait until this dating scan before they announce their pregnancy, and that's completely up to you. After your dating scan, We will offer you other screening and tests as well for things like your trisomies, which includes your Edwards-Patau's and Down syndrome. Some women choose to have this, some choose not to. There are other tests that you can have, but generally this is what happens in the first period of your pregnancy, and then we follow the pathway after that. You will be told how many appointments you will have. If it's your first pregnancy, you will have more. If it's your second or subsequent pregnancies, they are a little bit less, but they're very, very similar. At this point in time, we then decide whether you'll be under the midwives completely the way through until you have your little one, or whether you'll have shared care, which means you'll have some appointments with the doctors, some with the midwives, or whether we think that actually you need to have a higher input from the doctors and you might be under them the whole way through. Okay, so that's just a brief overview of your first part of your pregnancy, okay? Other topics will be covered in other videos, but that is everything for this topic now.